Have you ever been told that if you have knee pain, you just have to take a pain pill or get a cortisone shot, or even worse, get a knee surgery? Well, that's the biggest lie holding you back. But how about keep moving forward, and you should take your therapy because avoiding it will only make your knee pain worse. May adlaw na tong tanan. I'm Nathan, I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. Today, I'm going to share with you 3 of the most powerful knees over toes exercises I use personally after my own knee injury and with my patients over 50 to get rid of their pain, build strong muscles, build strong knees, and be able to regain their function and able to walk again. So what's really happening is this: knee pain after 50 isn't just from bad joints. It is about injured or weak tendons, neglected muscles, and the fear of letting your knees move forward naturally. But when you strengthen the right spots, pain goes away and function really comes back. You should be able to walk and do your favorite activities again. And I know this firsthand. I injured my knee while training jiu-jitsu, and it set me back really badly. And at first, I tried the usual, just resting, icing, compression, and in my case, I did the taping and elevation, but what I realized is that it wasn't enough. What saved me the most is learning the right technique and doing jiu-jitsu, and more importantly is doing my own rehab, my own exercises. I should be practicing what I preach, right? So after I strengthened my knee, I was able to gain my confidence again. And if you want to learn what I did on my own injury for my own therapy, follow along with me and let's get started. All right, so after doing and following the protocol, the right protocol, which is resting, icing, taping, if you want to learn more about that, I'm going to leave a link up here. So resting, icing, taping, and elevation. I started doing these exercises I'm about to show you. And the first one is the Tibialis raises. So you're just going to raise your toes up like this. All right? Put your hands at the side of your shin bone, and you will feel that muscle contracting. You're retraining from the bottom top to the top, or from the bottom up. So doing this exercise will prevent you from recurring knee pain. It will strengthen the areas that is around that knee. And when you are able to do this, you're also avoiding falls, because this is the muscle that is responsible of bringing your toes up when you're walking. So very important. One of the most neglected muscles by the therapist that is not being trained. So do this a lot. Now, in order to bring that to the next level, please try standing up and lean against the wall, about a foot away from the wall. Lean against it, and you're going to do the Tibialis raises like this. This will bring that to the next level. Shout out to the guy, the knees over toes guy. I learned this, and he had bad surgery, and his knees are also very bad, that he's supposed to be unable to jump anymore. But he researched on his own, and these exercises I'm about to show you, the 3 exercises, are the most effective ones. So try doing 10 times while leaning against the wall 3 times a day. All right? So this is the Tibialis raises. Do this 10 times. All right? And we're moving on to the next exercise. Right, the second exercise is walking, but not walking forward. We are going to walk backwards. You can do this outside or inside the house. Make sure that you are not going to bump to any objects. Make sure that you're doing this properly and safely. You can do this outside, which is, you have bigger space. But if you do it on a treadmill, try to be in a corner so that you have both sides that will catch you in case you lose balance. And put it on the lowest setting. So here's how you do it. I'm going to be very careful. You're going to land on your toes. Just be slow. I'm going to hold on to the wall just to make sure that I am safe. So you're going to land on your toes and then towards your heel, just like so. If you're doing this on a treadmill, put it on the lowest setting, like I said, and be very careful. This is like rewinding a tight coil, which is your tendon. We are always moving forward when we walk, or not always, but most of the time, 99% of the time we're walking forward. So it's also important to rewind that tight tendon by doing the backward walking. Please try to do this very carefully. I'm going to turn around just so you can see me better. But anyway, if you're doing this on a treadmill, do it on the lowest setting and maybe start with about 1 minute before resting. Now, if that gets easier, try to do it a little bit longer, maybe 2 minutes, then another minute after resting. Just do it carefully. But doing this will really help you improve your knee function, reduce your pain tremendously. So again, please land on your toes first and then on the heel, just like this, very carefully, and you are going to be intentional with your walking. When you're walking on a flat surface inside the house or outside, it is much easier. I'm just showing this so that I could, on the treadmill, so that I am able to talk while I'm doing the exercise, which is the backward walking. It will be so difficult for me to do when I am doing this video by myself, right? So try to do the backward walking, not the forward walking, in order to rewind that tight coil, which is your tendon, for about 1 to 2 minutes or 3 minutes a day. The split squat, which is done by putting one leg in front of the other and try to keep the back leg as straight as possible, will build the strength of your knee, your hips, and the balance, which is needed for a strong knee in order to protect your knee. It will also help with the mobility of your knee. So start with just a shallow squat first, then later on, as your ankles are also going to improve the mobility. When you do this a lot, you should be able to go deeper. Try to keep your heels down. If your heel is up, whichever one it is, don't move forward yet. Don't progress yet. You have to practice keeping your heel flat first until you're able to improve the mobility of your hip, knee, and your ankle. Just like that. All right? Let's do the other side. As you can see, my mobility is also not great yet. But as you keep practicing this, your knees will be protected. You should be able to go deeper. Let me try to go deeper. See, my back heel is already lifting, so I shouldn't be going deeper yet. You need to keep that heel down. Hold the position between 15 to 30 seconds, okay? So that might be about 5 seconds already. Let's do 10 more counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So again, start with a high split squat first. As you improve, go deeper into a deep split squat. All right? So practice this daily. Let's improve the mobility of our hips, knees, and ankles together. All right, if you are with me this far, or if you are ready to fight knee pain, type the word knee in the comment section, and that will also let me know that you are following along with me. You're trying to fight that knee pain. You don't want to take pain pills. You don't want to have cortisone shots, or you really don't want to have a knee surgery, which sometimes will be not advisable for you, especially if you have underlying conditions that won't let you have that surgery. And for me, what started the painful injury on the jiu-jitsu mat turned into a wake-up call. I learned that protecting my knee isn't about avoiding movement. It is about, doing my own therapy. It is about training them the right way. And also, of course, learning the right technique in order for me to avoid that knee pain from reoccurring. Now, this same exercises that has given me the confidence again to go back to the mats and do my favorite stuff, I'm using with my patients, and they have been seeing really great results. So please try them in your homes. You can supplement your therapy that you learn in the clinics, do these exercises. And if you know of somebody who has knee pain, especially if they're acute or a recent injury, try to share this video to them, and you will see that you'll be able to help them tremendously as well. If you have any questions, comments, or suggestions, just type them down below in the comment section. And just a reminder, consistency is the key and never give up. Until next time, paalam! Zoom!